Good evening, everyone. Now I'm going to discuss about neurological disorders, nursing management of patient with neurological disorders. In this, I'm going to take first topic is Alzheimer's disease. In Alzheimer's disease, what is meant by Alzheimer's disease? It's a one type of degenerative disorders of the neurological systems. Because of degenerative disorders, what happens? The neurons will get damaged. It is a progressive, irreversible, degenerative neurological diseases begins and characterized by gradual losses of cognitive function and disturbances in the behavior. Okay, it is a most common type of dementia. It's most common type of common form of a dementia. It's a progressive degenerative disease. Alzheimer's is a form of dementia. It's a complex brain disorder caused by a combination of various factors like the person will have loss of memory will be there, dysfunction of dysfunction or loss of memory will be there. He will have disorientation, attention seeking will be also not there. The patient will can't give his judgment and reasoning. Ultimately, these changes will be resulting in the individual's ability to work and fulfill the activities of daily living. Because of dementia, the person will not able to do the activities of daily living, so that the Alzheimer's is an chronic and it's an degenerative disorders of the neurological system. And let's see the difference from the normal brain and Alzheimer's patient's brain. In this, we have seen that normal brain is a very vasculature and everything is normal. Compared to in the Alzheimer's brain, all the degeneration has taken place. All the cells and everything has been shrinked up, and all the cognitive abilities and all the functioning of the normal functioning of the brain will be not takes place in the Alzheimer's disease. And incidence, let's go for incidence and prevalence. In the incidence, the most probably the most common cause of dementia in Western societies means in 2020, 5.8 million Americans were living with Alzheimer's disease. And worldwide population, let's see, experts expected to double every 20 years until 2040, means reaching 78 million in 2030 and 139 139 million in 2050. And most of the increase will occur in developing countries such as India, where the prevalences in currently is 3 million people are suffering with Alzheimer's disease worldwide. And let's see India's prevalence. In India's prevalence, 60 to 70% of these cases are common form. Dementia, the 4 million people are living with dementia in India. And in the incidence in India refers to number of new cases are identified within specific time period. Also is growing concern, means new cases are increasing annually and reflecting both the aging population as well as improved awareness and diagnosis also. Early diagnosis is occurring, and due to the aging process, the number of cases are getting increased annually. And the latest studies are also suggesting that number of cases are being identified with a specific time period. Means annually, the dementia and Alzheimer's diseases are going up, and it counts for around 60 to 70% of cases are increasing. So that's why we are seeing the incidence in India, okay, according to the survey. And what will be the risk factors? What will be the risk factors for mainly for the Alzheimer's disease? The first one is age factor. According to the age factor, the age increases automatically the degenerative age-related body system changes will seen in the old age people. Elderly people will have uh, these age-related body system changes. So the neurological system also gets progressively degenerated, and all the neurons will get damaged, and all the memory loss as well as cognitive dysfunction, judgment and reasoning, everything will occur. And second one, we will go for family history. Okay, in the family history, if we are in the family, anyone is having this type of conditions, that may reflect. Okay, and decreased blood supply. In the decreased blood supply in the brain, what happens? Decreased blood supply in the brain means all the metabolic activities in the brains will get altered. Due to the alterations in the metabolic activities, the brain will not sustain the hypoxic state, so the brain cells will get damaged. Due to the brain cells damaged, automatically the neurons will get demyelination and dysfunctions will occur. So here also degenerative process occurs due to the uh, decreased blood supply. And vitamin B12 deficiency and diet. Without vitamin B12 and proper diet also, we can't have the metabolic activities in the body. Okay. And next, infections like meningitis, diabetes mellitus, hypertension, and hyperlipidemia. This and all infections and this and all disease conditions will be leads to the lack of sleep as well as decreased blood supply. Due to the decreased blood supply, what happens? It leads to decreased oxygen supply. Aerobic respiration will be alters and anaerobic respiration will be coming up. So oxygen levels will be decreased and carbon dioxide levels will be increases in the brain. So brain again will go to the hypoxic state. Due to the hypoxic state, only the some extent only the brain can survive the hypoxic state. Okay, so that's why the brain will be affected and the cells and the brain cells and the neurons will get affected. And next we will go for sleep disorders. Disorders means lack of sleep. Lack of sleep will be leads to stress. The stress will be leading to the decreased blood supply, diabetes mellitus, hypertension will occur, bad cholesterol will be deposited in the blood vessels and it will block the blood supply. This and all will leads to this one. And social isolation. Social isolation will also leads to uh, Alzheimer's disease. And head trauma, head injury, head trauma or head injury. Head trauma or head injury also leads to the brain damage. If internal bleeding occurs also, the brain will get damaged. And the physical inactivity. Physical inactivity means if the person is not doing the daily activities and he is not having the habitude of doing exercises daily, and his lifestyle is becoming more means a sedentary lifestyle, which also be one type of physical inactivity will be there. Okay, due to the physical inactivity, the cholesterol levels will be rising. Okay, hyperlipidemia and obesity will occur. Due to the obesity, the cholesterol will be deposited in the blood vessels that will block the blood supply. Again, same scenario occurs. The oxygen supply will be decreased. Due to the decreased oxygen supply, what happens? Automatically, the brain will go to hypoxic state and the brain cells will get damaged. Okay, this and all will be the risk factors for the uh, Alzheimer's disease. Next, we will go for the pathophysiology. In the pathophysiology, mainly as a part of we will go for as a part of aging process, some neurons are damaged in the brain, and the damaged portions will form a plaques. Means the plaques are deposited. Means the healthy tissue will be gets damaged. Okay, due to the aging process. Already, I told in the aging process in the geriatric people, elderly people, what happens? The age related body system changes will be takes place. Due to the age related body system changes, some brain functions will be alters. So these plaques are consist of insoluble deposits of beta amyloid protein. Okay, this beta amyloid protein is having a property of digesting the surrounding cells like neurons. Okay, if this beta amyloid protein is digesting the neurons, what happens? The degeneration of the brain cells will be occurring. Okay, and the neurons will get subsided. Means in the antibodies, these are already formed in the areas of memory, cognition, language, reasoning, mostly in the cerebral cortex. Okay, this all the cognition, thinking ability, language, reasoning, mostly in the cerebral cortex will be takes place. So this will lead to this will lead to the affected part in the cerebral cortex starts striking. Means all the brain cells and cerebral cortex getting shrinked up. Okay, and degenerative process has been started, and brain atrophy occurs. Means damage of the brain also occurs in the Alzheimer's disease, and that will lead to Alzheimer's disease. This is about the pathophysiology. Let's go for clinical manifestation. In the clinical manifestations, we are having first foremost, the person will have memory loss. In the memory loss, the patient will forget everything. Forgetfulness will be there. Okay, if a person is doing anything, he will forget. Okay, and he can't remember anything. Changes in the cognition. Cognition means thinking, and disorientation of time, place, and things. The person will not able to have an orientation where he is, at what time it is, and what are the things around him is there, and forgetfulness is there, misplacement of the things, and he will be continuously doing the repetition of the repetitions. Okay, doing same activity he is doing repeatedly, and language and behavioral problems will be there for the person, and short term memory will be there. Okay, he will forget within a short period. Okay, these are all the clinical manifestations of Alzheimer's disease. Let's see the management. In the management, most probably we are having antidepressants. Examples in the antidepressants: fluoxetine and citalopram. Okay, citalopram. Okay, these are the examples for antidepressants. Okay, and antipsychotic drugs in the medical management. In the management, we will divide it on medical management, surgical management, and nursing management. Most probably, we will have medical management and nursing management. In the medical management, we are having antidepressants. In the antidepressants, fluoxetine and citalopram is antidepressants, and in antipsychotic drugs, example aripiprazole and pimozide. Okay, and vitamin B12 supplements we will give for the patient, and social isolation, and we will recommend the patients for the rehabilitation centers because of a cognitive dysfunction, as well as reasoning and thinking ability is not there, and he can't judge himself, and doing the activities repeatedly. Okay, repetition of the activities will be there, so that's why rehabilitation centers we will suggest for the person. And nursing intervention, what will be the nursing interventions for this Alzheimer's disease? Mainly we are having supporting cognitive function. Supporting cognitive function means in the thinking ability. Okay, the person will not have cognitive dysfunction will be there. We will help the person to think in a short term ways. Okay, and promoting the physical safety. Because of forgetfulness, they will have so many assaults or some other abuses will be there. So we are promoting the physical safety for the patient in the rehabilitation centers, especially, and promoting independence in self-care activities. We will make them to do their activities of daily in the self-care activities. Okay, and reducing the anxiety. We are giving the support for them, improving the communication skills, and promoting, especially we have to promote the adequate nutrition for the person, and promoting the balance activity and rest. Because of balance activity and rest will give the peaceful sleep. Sound sleep will reduce the stress levels will reduce all the metabolic activities will be in the normal state. Okay, and this is about the Alzheimer's disease. And next condition we will go in the neurological system is Parkinson's disease. Parkinson's disease. It is also known as Parkinsonism. Okay. What happens in the Parkinsonism and Parkinson's disease is it is a disease of basal ganglion cells, that is neurons, characterized by slowness in the initiation and execution of movement. Flawless in the initiation and execution of the movement, like bradykinesia. Bradykinesia means slowness, okay, in the activities, and increased muscle tone. rigidity will be there, and tremors, shivering at the rest, and you also impaired postural reflexes. Postural reflexes will be alters, and this is occurs due to the imbalance between neurotransmitters dopamine and acetylcholine. Okay, because of how why it is the Parkinson's disease is occurring mainly because of imbalance between the neurotransmitters like dopamine and acetylcholine. Okay, it is a disease of basal ganglion cells. Okay, neurons characterized by what are the symptoms that the person is having. What are the how can we identify the Parkinson's disease? By slowness in the initiation and execution of the movements. Okay, like bradykinesia. And the second one is increased muscle tone, means rigidity, and tremors at the rest period. Okay, tremors at the rest, and also impaired postural reflexes. Let's see the Parkinson's disease. Okay, how the patient is tremoring of hand, shivering is occurring, slow and shuffling gait, short steps. He can't walk properly. Okay, and hand hold forward. Okay, Parkinson's disease. The patient will look like same the screen. Okay, so the screen, the image is there. As it is the Parkinson's, the person will be looking like. Okay, what will be the incidence and prevalences? Okay, in the Parkinson's, the global prevalences, approximately 1% of the global population of age factor of 60 years. This is means the 6 to 7 million people worldwide are living with Parkinson's disease. Asia, especially in Asia, in countries such as China, Japan, and India, the prevalences of Parkinson's disease is generally lower compared to Western countries. Both the incidence and prevalences with age and Parkinson's disease is most common in men than women, because here the men is more are affected than women. For example, in the United Kingdom, UK, the prevalence rate for the people aged 30 to 39 is 4 to 5% per 1 lakh population. But the people aged 80 to 84, it's 1696 per 1 lakh. And in US, the study in 2022 found nearly that 90,000 people are diagnosed with Parkinson's disease every year. Okay, which is a 50% increase from the previous estimation of 60,000. A 2018 study also predicted that 1.2 million people in the US would be living with Parkinson's disease by 2030. By 2030, because of Parkinson's disease, the by year, the incidence and prevalences are getting increased globally. Let's see the Indian prevalence. It is estimated that around 1 million people have Parkinson's disease. The prevalences in the Indian population is lower compared to Western countries. Okay, compared to the Western countries, the prevalence will be compared to the Indian population. The prevalence is very low. Okay, and the incidence of Parkinson's disease, which refers to the number of new cases diagnosed annually, is estimated 10 to 20 per 1 lakh population per year in most Western countries. This rate is can be lower in less developed regions. Less developed regions. This is the incidence compared to the incidence and prevalence compared to globally and in India. And let's see the risk factors for the Parkinson's disease. Already we have seen that in the definition itself. It is an imbalance between the neurotransmitters like dopamine and acetylcholine. Okay, so mainly the risk factor, the main risk factor will be the deficiency of dopamine. And illicit drugs. Illicit drugs means the drugs which can't use regularly, means illegal drugs like cocaine, heroin, this type of drugs means the drug abusers. Okay, the drug abusers will be having more affected, and infections like brain infections will be there. All the vascular infection, peripheral nervous infections will be there, like meningitis. This and all will be gives examples for gives and risk factors for the Parkinson's disease. Stroke. Stroke means improper blood supply to the brain. If improper blood supply to the brain, that will leads to also decreased blood supply as well as decreased oxygen supply, and the brain cells will get damaged. Okay, and tumors, brain tumors. This brain tumors also, the tumor mass will be increased in the size, and it will constrict the blood vessels in the brain, and it will leads to the all the blood vessels will get constricted, and it will lead to the improper blood supply to the brain, and all the metabolic activities in the brain also alters due to the tumor. And head injury, damage of the head injury also leads to the damage of the brain cells, and internal bleeding may occur. Okay, the blood vessels may get ruptured. Okay, improper blood supply to the brain will be having, again the person will go for the hypoxic state. So it is also leads to the risk. It is also one type of risk factors. And intoxication of carbon monoxide and magnesium, copper, and methyl dopa and lithium will also damages all the brain cells. This intoxication of carbon monoxide means the oxygen levels will be reduced, and the carbon dioxide levels will be increases, and it also damages the all the brain cells and neurons in the brain. Okay, that will be leads to the Parkinson's disease. Because of this magnesium, copper, methyl dopa, and lithium, this may be also an occupational disorder. Okay, and they are having the more inhalation process also. Okay, these are all the risk factors. What are all the risk factors here? We are having deficiency of dopamine, illicit drugs, infections, and the stroke, tumors, head injury, as well as intoxication of carbon monoxide, magnesium, copper, methyl dopa, and lithium. Okay, these are the risk factors. Next, we will go for the pathophysiology. Will be the pathophysiology mainly here due to etiological factors like deficiency of dopamine. Let's take the one of the risk factor. Okay, due to the risk factors like deficiency of dopamine. Dopamine is a neurotransmitter. What happens here? It leads to interruption in the normal balance between the dopamine and acetylcholine in the basal ganglia occurs. Okay, interruption means the imbalance between, already we have seen in the definition, imbalance between the dopamine and acetylcholine. If what happens here, deficit in dopamine receptors at neuromuscular junction, and imbalance between acetylcholine and dopamine occurs, means the neuromuscular junction will not have sufficient amount of dopamine receptors and acetylcholine. Due to this, what happens? It leads to the all the motor function gets dysfunction. Motor function means all the movements. Okay, movements, all the slower in the activity like bradykinesia, rigidity. Okay, stiffness will occur, tremors, shivering, and shaking of the body will be takes place, and impaired postural reflexes means the patient unable to maintain his posture normally. This and all the group of clinical manifestations will indicate that it's an Parkinson's disease. What happens here? Because of imbalanced deficiency of dopamine, it leads to the interruptions in the normal balance between the dopamine as well as dopamine and acetylcholine in the basal ganglia occurs. Because of deficit in the dopamine receptors at where at neuromuscular junction, and imbalance between the acetylcholine and dopamine occurs, it will lead to the motor system dysfunction. What happens due to the dysfunction in the motor function? It leads to bradykinesia. What is bradykinesia? Slowness of the movement or movements that are slower than expected. It means bradykinesia means if a person is going to prick you, what you will do immediately? You will react and we will remove the hand from that place. But here they will be having the slow movement. They can't remove the hand immediately, and rigidity will be there, and rigidity will be there, and tremors, shaking will be there, and impaired postural reflexes will be there, and it leads to the Parkinson's disease. Okay, let's see the clinical manifestation. Bradykinesia. First one is the bradykinesia. Already we have seen this and all. Okay, bradykinesia means slowness of the movements, rigidity, tremors, hyporeflexia. Hyporeflexia means reflexes. The all the reflexes will be gets lowered. Loss of automatic movements. Automatic movements will be there. The person will look like an old man. Okay, impotence. Impotence means sterility. Means the patient unable to have the sexual wellness. Okay, and dementia means loss of memory will be there, and hallucinations, false perceptions will be there, and neuropsychiatric problems will be there. Okay, the patient will be having neuropsychiatric problems also. This and all will be the clinical manifestations for the Parkinson's disease. What are all the bradykinesia, slow movements, rigidity, stiffness, tremors, shivering and shaking of the body, hyporeflexia, low reflexes, and loss of automatic movements. Automatically, the patient can't uh, give the movement. And old man look, okay, the person look like old man appearance. And impotence, sterility, dementia, loss of memory, hallucinations, false perception, and neuropsychiatric problems. All the psychiatric problems also occurs for the patient. Okay. Next, we will go for the management. In the medical management, mainly, we will go for dopaminergic drugs like carbidopa and levodopa, carbidopa and levodopa, and anticholinergic agents. In the anticholinergic agents, also examples benzodopa and benztropine. Okay, benztropine. These are the examples for the treatment for the Parkinson's disease. Okay, and next we will go for the nursing interventions. In the nursing interventions, improving the first mainly we have to improve the mobility. Okay, improving the mobility. Okay, we have to make the person to do their activities of daily living, and enhancing self-care activities. Enhancing self-care activities. All the self-care activities done by the person should be followed himself, and we have to support him. And improving the nutrition, protein rich diet we have to takes place. And enhancing swallowing reflexes due to the shivering, and due to the slow reflex hyporeflexia, and as well as uh, bradykinesia, slow movements. The patient may can't swallow also, but we have to make them for enhancing the swallowing, improving the communication. Okay, the improving the communication and supporting the coping abilities, thinking abilities also we have to support the person. Okay, this all will be the nursing intervention. What are the main nursing interventions we will do in the Parkinson's diseases? Improving the mobility, and second one is enhancing self-care activities. Enhancing self-care activities. Improving nutrition. Third one is improving nutrition. The fourth one is enhancing the swallowing. Enhancing swallowing, because hyporeflexia is there. The person may have uh, swallowing reflex also, it may alters. Okay, the patient may have options of the swallowing reflex. Okay, and decreased swallowing reflex, or absence of swallowing reflex will be there, so that the enhancing swallowing will be we have to do. And improving the communication, and supporting in the coping abilities. All the thinking abilities uh, we have to support the Parkinson's disease person. Okay, this is about the Parkinson's disease. Okay, next we will see the trigeminal neuralgia. Okay, next condition is trigeminal neuralgia. What is trigeminal neuralgia? It's an cranial nerve disorders, are commonly known as peripheral neuropathy. All the cranial nerves disorders comes the first one is trigeminal neuralgia. What is the definition of trigeminal neuralgia here? It is a common disease of trigeminal nerve, the fifth cranial nerve. Okay, it is a mixture of motor and sensory branches. Okay, it is a condition. It is a common disease of trigeminal nerve, and a mixture of it is a mixture of motor and sensory branches. Okay, wherever the trigeminal nerve is present, in the ophthalmic branch will be there. This is a trigeminal nerve. It will be branching through three parts. Okay, the first one is going to the ophthalmic branch. Means ophthalmic branch means eye region, and maxillary. Okay, maxillary region also it is going, and mandibular. Okay, for swallowing, and mandible. Okay, mandible jaw. Okay, it is also uh, affecting the maxillary region. Upper respiratory tract infections also may occur. Okay, in this all the disease conditions, the trigeminal nerve will supply the branches to the ophthalmic branch as well as maxillary branch and mandibular branch. What are the incidence and prevalences here? Okay, in the incidence, it is a rare condition that affects 12 out of every 1 lakh people every year. Means the incidence varies by location and age, may be higher in females. The United States 5.7 per 1 lakh women, and 2.5 per 1 lakh men will be seen in the United States. In central Sweden, only 5.5 per 1 lakh person per year, and higher incidence in older people. Okay, as the age increases, the all the body system changes will seen. In Korea also 82.11 per 1 lakh persons in every year in 2014, increasing to 100 in 2018. Other studies have reported different incidences ranging from 8 to 29 cases per 1 lakh persons every year. Okay, this is the incidence and prevalences of trigeminal neuralgia. This is a rare condition and only seen 12 out of every 1 lakh people each year. Each year, and this incidence also, trigeminal neuralgia incidence also varies by location and age. May be higher in females. Okay, not like Parkinson's disease and Alzheimer's disease. They are having higher incidence in males. Okay, but here the females are higher incidence. Okay, and compared to United States and Central Sweden, the United States are more incidents are there. Okay, okay, and other states, other studies also reported that ranging from 8 to 29 cases per 1 lakh person, 1 lakh person for every year we have seen. What are all the risk factors we are having? Okay, for the trigeminal neuralgia, the risk factors are mainly tooth infections. Tooth infections, already we have seen the trigeminal nerve, which is supplying the maxillary region and mandibular region and ophthalmic region. So, in the tooth infections, the chronic recurrent tooth infections also affect the fifth cranial nerve, and encephalitis. Okay, encephalitis, inflammation of the brain also will be leads to the trigeminal neuralgia, and compression of the blood vessels. Compression of the blood vessels in any reasons. Compression may occur. Any mass and tumor will occur. Any injury happens. Any other causes, compression of the blood vessels takes place. See, in the compression of the blood vessels, we have head injury is there, as well as brain tumors is there. As the brain tumor is there, it's a mass that will increases in size, and it will compress all the blood vessels. And in the head injury, it will rupture all the blood vessels in the brain, and it will compress, and it will block the blood supply to the brain. That also it leads to the blood supply to the brain also will decreases. Due to the blood supply decreases in the brain, it can't supply the blood to the cranial nerves, so the fifth cranial nerve will get damaged. Next, we will see the pathophysiology. Due to the risk factors like brain tumor in cerebral cortex. Okay, risk factors we have taken the example as brain tumor. What the brain tumor is doing here inside? It compresses the blood vessels, and blood supplying to the trigeminal nerve ending. Means the brain tumor, the mass will be compressing all the blood vessels, and the cranial nerves, fifth cranial nerve is also gets damaged, and the blood supply is also not supplying to that nerve. What happens automatically? The ophthalmic region, the maxillary region, and the mandibular region, the three branches will not get the blood supply properly. What happens after that? It leads to the decreased blood flow. After decreased blood flow, the nerve cannot send the impulses. Means the trigeminal nerve is there that supplies the impulses to the eye, ophthalmic region, maxillary region, and mandibular region. The nerve will not supply the impulses. All the impulses will be gets blocked. What happens automatically? The person will have trigeminal neuralgia. In this trigeminal neuralgia, what will be the clinical manifestations? The main clinical manifestations is mainly pain. What type of pain? Severe pain like burning. Okay, there are lots of types of pains are there. One type is burning. Okay, and pricking pain is there. Shock in the lips, jaw, and tingling in the forehead. Okay, there is a tingling sensation in the forehead will be there. Okay, shock will be because of insufficient supply of the blood supply. The lips and jaw will also not get proper blood supply, and intense pain will be there. Intense pain will be there. And the last one is blinking of the eyes. Ptosis will occur. Ptosis means the trigeminal nerve is supplying the blood to the ophthalmic region also, due to the improper supply of the nutrients as well as oxygen as well as the blood supply. The blinking, the recurrent blinking of the eyes will be occurring. Okay, thus that type of condition is known as ptosis. What are the clinical manifestations here? Due to the nerve cannot supply the impulses because of uh, decreased blood supply to the trigeminal nerve. Due to the decreased blood supply to the trigeminal nerve, what are the clinical manifestations we are seeing? Severe pain like burning and pricking pain, shock in the lips, jaw, and tingling sensation in the forehead, and intense pain will be there, and blinking of the eyes will be there. And let's go for the management. In the medical management, mainly we will go for anti-seizure drugs. Example, levetiracetam and diazepam. And the radiation therapy of fifth cranial nerve. Radiation therapy. Due to the radiation therapy also, we can manage the damaged area. Okay, and surgical management. In the management we will have three sectors: medical management, surgical management, and nursing management. The first one is medical management. We will go for pharmacological management. The pharmacological management, we will suggest anti-seizure drugs, anti-epileptic drugs like diazepam, and we will go for the radiation therapy. We will the damaged blood vessels will be corrected by the radiation therapy. Okay, directly to the fifth cranial nerve. And next we will go for the surgical management. In the surgical management, rhizotomy. Rhizotomy means the blocking of the nerve. Means the trigeminal nerve ending where the more pain is occurring. Okay, in that area the nerve will be get blocked by the surgical procedure called rhizotomy to reduce the chronic pain for the patient. And it is by electric cutlery or any surgical instrument they will block the nerve. Okay, it is known as the surgical procedure is known as rhizotomy. And let's go for the nursing intervention. The patient avoid exposing affected cheek to sudden cold. Means the person is having fifth cranial nerve damage. So the maxillary region and the mandibular region is affected, and the ophthalmic region is affected. So the patient should not expose to the sudden cold, and avoid foods that are too cold or too hot. They can't able to tolerate the too cold and too hot and hot food items, and choose the food in affected area. They should not chew the food in the affected area. Administer analgesics which relieves pain and prevent pain. We have to administer the analgesics. Examples: diclofenac and tramadol, this and all the drugs which relieve the pain and relieve the pain, prevent the pain. Serum blood vessels of the drug, serum blood levels of the drugs are monitored in long-term use. In the long-term use, instruct the instruct the patient in the methods to prevent instruct the patient in methods to prevent environmental stimulation of pain. Means diversional therapy we can suggest. We have to provide emotional support to the person who is suffering with the trigeminal neuralgia, and avoid provide next provide adequate nutrition in small frequent meals at room temperature, and use cotton pads, gently wash face or for oral hygiene. We have to maintain oral hygiene because the nerve supply to the mandibular region and maxillary region is not there. Inspection of the eyes for the foreign bodies, which the kind not able to feel, should be done several times a day. Because of continuous blinking of the eyes, the patient have ptosis. Any foreign particle may enter into the body, into the eye. The inspection of the eye should be frequently done. Normal saline irrigation of the affected eye 2 or 3 times a day is helpful in preventing corneal infection. Means the saline irrigation, okay, in the saline irrigation of the affected eye also we have to do for 2 to 3 times a day is helpful in preventing corneal infection. How we have to do the saline irrigation? From inner canthus to the outer canthus, where from the inner canthus to the outer canthus we have to pour the normal saline, and we have to wash the eye with the help of the kidney tray. We have to collect all the saline, okay, which was irrigated. And dental checkup every 6 months is encouraged, because since the dental caries not produce pain, but the dental caries may spread the infection to the trigeminal nerve also. Okay, explain to the client and his family the disease and its treatment. We have to explain every treatment regimen to the person as well as the client as well as the family members for better coping up with the activities of daily living. Okay, so the person may have uh, cooperation and coordination, because sudden telling about the disease condition also it's not good. Because of that we have to give the psychological support. We have to explain all the treatment remedies, and what are the preventive measures we have to take, and what are the necessary steps, what are the early diagnosis of the disease condition also we have to explain to the person. And we have to explain each and everything, what are the risk factors, what are the clinical manifestations, and what will be the management. This and all we have to tell the person and as client as well as the family members about the disease condition and its treatment. What are the nursing interventions we have seen? Avoid exposing affected cheek to the sudden cold. And sudden, we have to not take the foods too cold and too hot. Chewing the food in the affected area. And uh, administer analgesics which relieves the pain and prevent the pain. Serum blood levels of the drug are monitored in long-term use. If the person is taking prolonged medications also, we have to see the drug levels in the serum blood, and instruct the patient in the methods to prevent environmental stimulation to the pain, and provide emotional support and as well as the psychological support in the nursing interventions the person who is suffering with trigeminal neuralgia, and provide adequate nutrition in small frequent meals at room temperature. Means already we have discussed that adequate nutrition will be taken, and too hot foods and too cold food should not be taken. This should be avoided, and use the cotton pads gently, and wash face for oral hygiene. Oral hygiene should be maintained, and face wash should be done frequently with the help of cotton pads. And inspection of the eye should be there. If any foreign body are present, we have to go for the normal saline irrigation for the affected eye for 2 to 3 times, and this will helpful in preventing corneal infection. And next one is dental checkups for every 6 months is encouraged, because since the dental caries are not producing the pain, but it can spread the infection. It can spread the infection. And also finally we should explain the client about the disease condition, about the disease condition, its treatments and its contraindications as well as complications of the disease condition to the client as well as to the family members. This is about the trigeminal neuralgia. The next condition we are discussing about Bell's palsy. It is also one type of cranial nerve disorder. In the trigeminal neuralgia, it is the fifth cranial nerve, and in the Bell's palsy, it is the seventh cranial nerve. It is an acute peripheral facial paralysis. Paralysis means all the facial muscles gets paralyzed, means these all not will be functioning. Okay, the person will have expressionless, so he can't give any expressions from his face. Okay, this type of condition is known as Bell's palsy. It is mainly the condition of seventh cranial nerve, and it is an acute peripheral facial paralysis. It is known as an acute peripheral facial paralysis. What will be the risk factors here for the Bell's palsy? There are two types. Two risk factors will be there. First one is the viral infection. Viral infections like herpes simplex virus. The person who is suffering with herpes simplex virus. And the second one is autoimmune condition. Okay, autoimmune condition. Next, we will go for okay, Bell's palsy. What happens? See, the drooling of the mouth is there. Okay, the facial nerve. This is all the facial nerve, and the drooling of the face is there, and inability to close the eyelids. Okay, all the facial, the seventh cranial nerves will be gets damaged, and the blood supply to the blood vessels, the muscles as well as the facial muscles will not take place due to the improper blood supply. What happens? All the muscle activities get altered. Okay, dysfunctioning of the facial muscles will be there, so that the facial drooping of the mouth takes place and inability to close the eyelid. So the facial paralysis, the person will have expressionless. Let's go for the pathophysiology. Due to the risk factors like viral infections, already we have seen the risk factors. The first one is viral infections, as well as the second one is autoimmune disorders. Okay, so the first we will take the example as viral infections, herpes simplex infection virus. It leads to the what happens? It leads to the inflammation. The inflammation will be leads to the edema. Okay, swelling of the facial muscles and nerve endings will be gets alters. Okay, and it leads to ischemia. Ischemia will leads to deficit blood supply. Deficit blood supply to the facial nerve will lead to the demyelination of the nerve. The facial nerve, the seventh cranial nerve will have demyelination. What is meant by demyelination? All the myelin sheet which is present on the neuron will be gets disintegrated, means degenerated. Due to the degeneration of the myelin sheet of the seventh cranial nerve, the seventh cranial nerve functioning will be gets altered. Changes in the seventh cranial nerve functioning. So automatically, due to the improper blood supply and demyelination of the seventh cranial nerve, the facial muscles will get paralyzed, means functionless. So it leads to the Bell's palsy. What happens in the pathophysiology? Due to the risk factors like viral infections, leads to inflammatory process. In the inflammatory process, what happens automatically after entering the virus into the body, antigen and antibody reaction takes place. Due to the antigen and antibody reaction takes place, the end products like lactic acid will be producing. The lactic acid is having the functioning of killing the cells. Due to the damaged cells and improper blood supply and everything, what happens is edema will be forming. Okay, it leads to edema as well as it leads to ischemia, and ischemia will lead to deficit blood supply, means decreased blood supply to the seventh cranial nerve. Due to the decreased blood supply to the seventh cranial nerve, demyelination occurs because the neurons and the nerves will not have proper metabolic activities. Due to the improper metabolic activities, as well as due to the low nutrition supply, because of deficit of blood supply, alterations means the changes will occur. Alterations in the function of seventh cranial nerve will be takes place. Seventh cranial nerve will be takes place. It leads to Bell's palsy. Bell's palsy means facial paralysis. Let's go for clinical manifestation. Already we have seen in that picture of Bell's palsy, drooling of the mouth. The first one is the drooling of the mouth and twitching of the facial muscles. Means the shape of the facial muscles and the face will look like irregular. Means paralysis. The functioning, the facial muscles will be not in the functioning state, and hearing deficit will be there. The patient will have diminished hearing. Okay, and social isolation will be there, and the expression less face means the person is having will not have expression. Okay, expressionless face will be seen. What will be the clinical manifestation? Mainly we are seeing in the Bell's palsy. The first one is drooling sensation, second one is twitching of the facial muscle, and the third one is hearing deficit and social isolation and expressionless face. These are all will be the clinical manifestations of the Bell's palsy. Next, we will go for the management. As the Bell's palsy is having the risk factor of antiviral agents, the example for antiviral agents is acyclovir as Jovirax. Jovirax. These are the medical management, and in the medical management, first most we are going for the antiviral agents. In the antiviral agents, the examples are acyclovir and Jovirax. And anti-inflammatory drugs we are suggesting for the patient. In the anti-inflammatory drugs, we will go for all the antibiotic therapy and corticosteroid therapy. In the corticosteroid therapy, we will go for hydrocortisone, and hydrocortisone is a main example, and example for the corticosteroids, and mainly the physiotherapy. Physiotherapy and this facial muscle exercising. Okay, mainly facial muscle exercising will be leads to the function proper functioning, as well as improving the blood supply to the facial muscles. That will give the proper nutrition as well as the metabolic activities of the facial muscles. This is the medical management for the uh, Bell's palsy. Next we will go for the nursing management. The nursing management, keeping the integrity of the cornea. Keeping the integrity of the cornea, mainly we will see the place an eye patch on the affected eye during sleep to keep it shut, because inability to the close eye will leads to the more foreign bodies may affect the eye, so it will lead to some other complications of the ophthalmic conditions will occur. So to avoid all this, we will place an eye patch on the affected eye during the sleep to keep it shut. Okay, encourage the patient to report immediately if any pain experienced around the eye, reporting the level of pain and its location. Means the patient should inform if any pain is experienced around the eye, and reporting the level of pain at its location. Exact location we have to find out, and we have to give immediate remedies to reduce that pain, and assess the condition of the eye, including redness and any discharges. If any redness and if any discharges are there, we have to assess the eye condition, and we have to tell the patient to inform immediately, and teach the patient to administer artificial tears or ophthalmic ointment as ordered by the physician. What happens here? We have to administer artificial tears or ophthalmic ointment as ordered by the physician. Okay, and we have to teach the patient how to administer them, how to install the installation of the artificial tears. We have to how to apply the ophthalmic ointment. That and all we have to explain to the patient. What is the second one? Elevating the pain. Elevating the pain Instruct the patient to place moist heat on the face. Moist heat, the hot moisture heat will relieve the pain. Okay, and perform routine massage on face to relieve the muscle pain. Okay, routine massage as advised by the physiotherapist. We have to do the facial muscle exercises to relieve the muscle pain, facial muscle pain. Teach the patient to administer corticosteroids to minimize the inflammation and non-narcotic analgesics to reduce the pain. Okay, we have to teach the patient to administer, to take the medications in the medical management in the corticosteroids to minimize the inflammation as well as the non-narcotic analgesics to reduce the pain. Okay, narcotic analgesics and non-narcotic analgesics are separate. Okay, we have to suggest the patient non-narcotic analgesics to reduce the pain. Okay, the next one, the nursing interventions, the mainly we will go for patient education as well as the health maintenance. Encourage the patient to use wrap around the glasses to minimize the evaporation of moisture from the eyes due to the wind and sun. Whenever the patient is going to the outer atmosphere, like sunlight or a heavy windy areas. Okay, in these sectors, the patient's moisture of the eye will be gets lost. Okay, because the patient is having facial paralysis, so the patient is inability to close the eyes. So encourage the patient to wrap around the glasses to minimize the evaporation. Means the moisture gets evaporated because of heavy wind or due to the heavy sun exposures. Okay, protective glasses are also encouraged to be worn to avoid irritants from entering the eyes. This also helps in increasing the humidity of the environment, because the person who is unable to the close eyes due to the facial paralysis, they have to wear the protective glasses to avoid the irritants from the entering the eyes. Any foreign particle may enter into the eye, or any dust particles also, any means moist this pollens, okay, in the which are present in the air may enter. Any spillages happens in the spillages also, the person can't able to close the eyes, inability to the close eyes, that also enters into the eyes, that and all affects the eye. So the protective eyeglasses should be encouraged to worn to avoid the irritants from entering the glasses, but entering into the eyes. Instruct the patient to on the proper ways for of closing the eyelids and the eye patching. Okay, instruct the patient on proper ways of closing the eyelids and eye patching. How to wear the eye patches and how to close the eyelids in the proper way. That we have to educate the person. This and all for the maintenance of the health. We are recommending for the person, and demonstrate the correct method of facial exercises. Demonstrate the correct method of facial exercises, including eyebrow raising, lip pursing, and eye squeezing. Eye squeezing. This and all the facial exercises which are recommended by the physiotherapist, that should be encouraged, and we have to demonstrate to the patient in a correct method for good health maintenance as well as the patient education also, and emphasize the importance of performing the exercises to prevent the occurrence of muscle atrophy. The muscle atrophy, okay, muscle wasting will be there. So the exercises will be preventing the muscle atrophy also, for occurrence of the muscle atrophy also, because in this state, if you are performing correctly the exercise, it will help you to prevent the muscle atrophy. So the correct method of facial exercises should be explained to the patient, and we have to make them to do the correct method, and we have to demonstrate, we have to show them, and we have to see we have to supervise why they are doing correctly or not, how many times they have to do, in which timing, and which atmospheric conditions they have to do that facial exercises, that and all we should explain according to the physiotherapist. Okay, thank you. And if you are having any doubts in this neurological disorders, as well as if you want more content to see this in these conditions, you can visit and you can download and you can subscribe the Prakara app for more information anytime. Okay, thank you.